Going to present about a mystery of I want to talk something about BIMSSCON. BIMSSCON. I guess all the smart medical students are in BIMSSCON. So this is one of my experiences, I must say. Before today's presentation, I already presented so many times, and I worked with the many students of these smart students of Bangladesh. So this is a proud moment for me because you people again here, and I'm going to take the presentation for you all. So I'm going to start my today's presentation, Mystery of Medical Ultrasound. So before that, what is ultrasound? And there is a word which I have used already, that is mystery. I always think ultrasound is a mystery because this is the mystery of black and white world. So I have already mentioned black and white world. Okay, let's start. So I'm not going to tell anything which is very hard. I will tell ultrasonogram is just an investigation. And usually we start an ultrasonogram with the ultrasonogram machine. So let's start the machine. Here I have showed there are two types of machines. The first one, which is trolley-based machine or fixed type machine, which I have shown in the first machine. And the second one, which is portable machine. The first one, which seems like a desktop computer, you can see. And the second one, which is like laptop computer. So there are many other variations of ultrasonogram machines, but these two types of machines are very common. Now, you need to know, before knowing medical terminology, about some definitions or some like terminologies. The first one, which is sonographer and the sonologist. You need to know about who is the person who is a sonographer and who is sonologist. Think there are two people. Both of them have very good idea and certificate regarding ultrasonogram, medical ultrasonogram. Among them, the person who is a doctor, we will call him a sonologist. On the other hand, the person who knows about ultrasonogram and who have a degree regarding ultrasonogram, but he is not a doctor at the moment, we will call him a sonographer. So both the sonologist and sonographer know about ultrasonogram, but among them, the person who is a doctor, we will call him a sonologist, like us. If we know ultrasonogram very clearly with a degree, in future will be called sonologist. Now, the most popular thing of ultrasonogram, this is sound. So let's start with sound. What is sound? We know from the very beginning of our childhood that sound is an energy and like that, right? So I'm going to start with this mystery of sound. Basically, sound is an energy which is a mechanical energy that arises from a source and transmitted through a medium due to some kind of frequency or vibrations. Whenever the frequency sustained within our hearing limit, we usually heard the sound which is known as audible sound. We all know about the sound frequency that is 20 to 20,000 hertz, which is within our audible range. And below 20 hertz, it is not audible, and above 20,000 hertz, this is not also like audible, you know. So below 20 hertz, the non-audible sound is known as the infrasound. On the other hand, the sound which crosses 20,000 hertz is known as ultrasound, not suprasound. So there are two types of sound. I can say that audible sound and inaudible sound. Audible sound ranges 20 to 20,000 hertz, the frequency range, and inaudible sound more than 20,000 hertz is known as ultrasound. So we have already arrived in the mystery of ultrasound. Let's go into it. It is medical ultrasound. So I have already mentioned all the things. The sound or the ultrasound that is used to diagnose various medical problems and which used to scan number of organs in our body is known as medical ultrasound. And in medical purpose, the range of ultrasound that we use is 2 to 20 megahertz. I have already told you. and the relationship between the hertz, kilohertz, and megahertz, which is shown detailed in my slide, you can check. Now, about the machine, which is very, very important. Let's start with this game zone. I will say this is a game player, must say. Let's start. This is a desktop. I can see here, I'm showing here, this is a desktop. It's just like a desktop computer. It contains a monitor, a pulse control. This is not a familiar word, but a monitor or display, this is very familiar to you all. The keyboard, this is also very familiar. I have skipped already the pulse control because I will come, because this is the main part of your ultrasonogram machine. That's why I will finish the known things at first. The keyboard, this is very common. We have a keyboard in our mobile phone, in our computer, laptop, everywhere. The computer and printer, this is the main hardware things where you use and print the picture. So now another thing, which is transducer, which is not shown in this picture. So if I consider this is a desktop computer, we can find that there are two new things which usually not known. Number one is pulse control and another one is transducer. And rest of the things, we are very much familiar with all the other things which I have already mentioned. Now go for the pulse control. So here is the like laptop-like structure, laptop keyboard-like structure, which is actually containing two things. Look, I have mentioned one thing that is part of a keyboard of an ultrasound machine. You can see this is a keyboard, right? So first thing, the A, B, C, D, whatever written, this is keyboard. But rest of the things, this is not a part of keyboard. But why I mention like that? Because most of the people, when I ask that what is it, people answer me, this is a keyboard. But basically, this is just not a keyboard. That's why I made a wrong here. I made a mistake here to understand clearly. Basically, this is a keyboard as well as, sorry, as well as a pulse control. So usually a sonogram machine contains keyboard with a pulse control. So now I'm going to show you about the keys of this mysterious pulse control. So think here is a key which is known as fridge. We can clearly see the fridge button. Whenever you are going to ask a patient to fall, and whenever you are going to check any kind of organ with a transducer, I'm going to tell you detail about the transducer later. At that moment, think you are going to find a structure which you want to capture. At first, you need to freeze the picture, and this is the key where it will be used. So freeze is an important key by which you can freeze or during your scan. So freeze is very much important. You can say that if I want to unfreeze at that moment, what can I do? It's just like your movie pause. Like whenever you are going to watch a movie, you need to pause it. You will pause it, and whenever you want to unpause it, you just pause it again. So here you will just freeze it. It will be fixed, and whenever you are going to freeze twice, it will be unfreeze. That's so simple. Next, whenever you are going to freeze a picture, what do you want to do? We actually measure the structure, calculate the volume of the thing, or we need to indicate any kind of pathologies. You are going to find all the keys from here. There is a circular, semicircular structures like the semicircular keys, which are shown here. Here, all the keys is present. Today I'm going to show you also a practical session where I will show all the detail of the key as well. So now here there is a key which is known as distance. You can see here distance, trace, then other some keys by which we can fix a organ, and we will measure the distance as well as the volumes, all the details of this organ. Okay, so there are some keys you can see. There is a volume type, circular some keys. There are some keys which looks like button, which we can do, or we can make it in the right side or in the left side. We can see very clearly. All the keys are known as gain. In ultrasonogram, gain is very important key. That is, whenever we want to clear any structure, like we want to make darker or we want to make whiter, at that moment we need to use this key known as gain. So whenever, the simple thing is, whenever you need to sharpen the structure at that moment, we have to use this gain. Either we have to lightening or darkening. So during these conditions, we need this key, which is known as gain. Now, sometimes you can find that we usually find in our work, usually we can find there are some ultrasonographic report where we can use dual pictures together, like two pictures together. At that moment, we can divide our screen by pausing this dual key. Again, if you want to back to your single picture, you need to pause the button B. And other keys which are shown here, which is usually used for Doppler ultrasonography. This is a very important ultrasonography study. We will not discuss here. But before I'm skipping that page, I'm going to repeat some keys. That's freeze, that we need to, whenever during scanning, whenever we need to freeze these things, we will use freeze. The gain button to clear the picture, the measurement buttons, the amount, the volume, or the distance of the structure, and dual picture to have the picture together, or the single picture to return in the picture again. Now, the transducer. So here I'm going to give a summary of this slide. This is containing, which is actually pulse control. So pulse control is one of the most important part of an ultrasonography. Here you will find which is called freeze. During scanning, if you want to fix any picture, you need to use this button, freeze. And if you want to unfreeze it, just press again. And now, after freezing, you need to calculate our measurement of the structure. Here you can use this measurement tools by which you can make a distance or amount of the volume or any other things. Like in pregnancy profile study on other things, you will use these buttons. You can use the dual pictures. You can come back to the single pictures by using these buttons. And one of the most important is for fix the gain or the clarity of the picture by using these buttons. So now moving to the next thing, very important part of an ultrasonogram machine, which is transducer. You know transducer. Transducer is an important substance which converts one kind of energy to the another kind of energy. And here in ultrasonograph machine, this transducer will convert the electrical energy to ultrasound. So there are many layers of transducer. We don't need to know about the detail of the machine structure. We just need to know that there is a structure which is called piezoelectric crystal, which actually converts the electrical energy to ultrasound. Now I'm going to show you how it works. It's very interesting. Just look, this is a transducer which is connected with our graphic machine. It transmits some sort of electric energy to the transducer, and then transducer will convert this electrical energy to sound, ultrasound. Now this ultrasound will enter in our body during our examination. And it is crossing all the layers of our skins, muscles, things, and it will go down to the deeper part of the body. And now the sound will make some vibrations because that sound reflects, right? And the reflection of the structures, like if the structure is very thin, the reflection will be very thin. If the structure is hard, the reflection will be very hard. So all the structures, all the reflections will go back to the ultrasound machine. And these structures, the reflections, again, this ultrasound, again, will convert it into electrical energy. So here, this is a very interesting thing. At first, the electrical energy will convert into the sound, then sound will form a reflections of all of the structures of our body, and then it will go again into the ultrasound machine, and we convert it into electrical energy again. And the electrical energy will go to our machine, and the machine will sketch by receiving component of the electrical energy and scan a organograms, like scan a organ structure, which will be just like similar to our body structure. So this is the mystery by which an ultrasound machine creates our body scanning. Okay. So what is the role of the gel, you can see that before ultrasonogram we need to use a gel because it actually creates a medium where the sound elevating down towards the desired structure. Otherwise, the frequency is so high, it will disperse here and there. But whenever you are going to use a gel, it will create an ambient where the sound can directly like transmit to the desired tissue. Okay, so we can use our instrument or also directly into the body. Now, what is echo? Actually, ultrasonogram is echo procedure. It will create the pictures. I have already shown you that this is the echo thing, right? So whenever sound goes, and there it will form an echo, and this echo will create the picture. Okay, now how can we study, or how can you write a report, and how can you understand about the structures? So this is a trick. There are two types of color which we experience during ultrasonography. We all know this is black and white, and all the shadows of black and white, like light black, darker black, whatever it is, and light white, lighter white, whatever we can say. So these are the colors we understand. We can easily understand of an ultrasonogram. So now, this mystery, we are going to solve this mystery. What is black? This is a very easy thing. You need to remember, in the most of the cases, black is fluid. And what is white? Cell is white. So if you divide molecularly our physical things like body, at that moment you can find these two basic things, that is cell and water. And you will convert the water in the color black and convert the color, color of the cells to the white. So it will create the specific organ. So now you can calculate if an organ which consisted more fluidic things, then it will be darker. If the cellular consistency is more, it will be whiter. Like, I'm going to give you an example. Like, if you think, I'm going to ask you that what will be the color of these four organs, like gallbladder, liver, diaphragm, and okay, calculate among these three. Just think that what will be the color serially. The gallbladder, it contains gall or bile. This is actually fluid, right? Then what will be the color? It will be the darkest one. Compared to liver and diaphragm, then the consistency of the liver, it contains mainly cells. So it will be whiter than gallbladder, right? And the diaphragm, which contains the maximum consistent of cells, right? Consistency of cells. So it will be the whitest one here. So if we maintain the serial things, then at first the black one will be gallbladder, the second one will be liver, and the whitest one will be diaphragm. By this situation, we are the ultrasonologists usually diagnose the thing. Like if the liver is suffering from any kind of chronic disease, like fatty liver, any kind of fatty liver or chronic disease, then what will happen? The fibrous tissue will accumulate in the liver. Fibrous tissue will be the cell, then it will be whiter. Then we will compare with the diaphragm, and we will find the diaphragm and the liver. The color of the diaphragm and the liver will be similar. Then we can say that the cellular consistency of the liver increases, and so it is suffering from kind of chronic disease or fatty liver. So this is how we actually diagnose. So we need to know about the cellular consistency and the color distribution of the organs. So now the terminology, this is very important. This is very important things, because whenever you are going to receive any report, you need to understand about these terminologies, or if you know about the terminologies, you can write a report by seeing an ultrasonographic picture. At first, the ISO equip. In the medical college, we have learned that ISO means same, right? So whenever the color of two different organs are equally same, we will call it isoequate, right? Like if I say the liver is isoequate in all over its structure, it means the whole liver looks similarly same color. What is anequate? Whenever you are going to find completely black structure, this is anechoic, like gallbladder. Urinary bladder, it does not contain any kind of echoes or any kind of cells inside of the gallbladder or urinary bladder. So it will be echo-free or anechoic. Now, whenever you are going to find some kind of organs, whenever you are going to make a comparison between two organs, at that moment, what will happen? One organ will contain more cell, another organ may contain the less cell. If the cells are similar, at that moment, we will call it isoechoic. But whenever one is whiter one and another is like darker one, at that moment, to the whiter one, we will call it hyperechogenic or hyperechoic, and the darker one will be called hypoechogenic or hypoechoic. So now think, I have already give you an example that's about gallbladder, liver, and diaphragm. Now just term it. The gallbladder will be the anechoic one because it does not contain any cell inside of gallbladder. So we will call it a gallbladder is an anechoic structure. Same goes for the urinary bladder. We will call an urinary bladder anechoic structure. Whenever we are going to compare between the diaphragm and liver, we can write in ultrasonographic language that is liver is hypoechoic than diaphragm because liver is containing less cell than diaphragm. We can't write that bright things like broad things, right? And you can just term it like liver is hypoechoic than diaphragm. On the other hand, for diaphragm we can say like that diaphragm is hyperechoic than liver. Okay, so this is the thing. Whenever you are going to get a report, at that moment you will find this hyperechoic and hypoechoic, then you can easily understand that which organs actually containing more tissues, which organ is containing actually less tissues. So these are the like just terminologies you have to understand, and after learning this terminology we can write the report easily. Okay, so there is a structure I'm going to show you. I have already mentioned you so many things. We can see if we're going to term all the structure, then how? Think this is a structure. All over the echogenicity is same. In the central part is not, but all over the echogenicity is same. So we can see this portion compared to this portion is isoechoic, right? So isoechoic. These portions are isoechoic. If I go inside of this structure, this is completely black and this is totally lack of cells. We will say this is anechoic, right? Now I'm going to compare this zone to this zone. You can see this zone is whiter, sorry. It means it is containing more cellular structures compared to this area. So we will call this area is hyperechoic or hyperechogenic. On the other hand, we will say this area will be hyperechoic or hyperechogenic than this area. So these are the terminologies. I'm going to add in some extra things, like you can find a pathology here which is creating a shadow, black shadow. This is called posterior acoustic shadowing. This is the commonest feature during diagnosis of a stone. So whenever you are going to find a stone, it will be very hyperechogenic structure and it will create a shadow like that. So this is an important thing you can learn where you can diagnose the stone easily. On the other hand, whenever you're going to find a dark zone, which is actually fluid, posterior part of that fluid, you can find there is a bright zone, which is called acoustic enhancement. So there are two different things. Like in the back side of the cellular structure, you will find the posterior acoustic shadowing, and the back side of the dark zone, you can find posterior acoustic enhancement. So I'm going to summarize this picture. After that, you can like understand all the terminologies. I have already mentioned all the terminologies. So this will be isoechoic. Whenever the color is similar, the cellular structures are similar, this will be called isoechoic. When it will contain only fluid and black, will be called it anechoic. And when we are going to compare the regions, the brighter region will be called hyperechogenic. The darker region will be called hypoechoic. And for the stone, if the darker, the whiter zone containing a shadow, we will call it posterior acoustic shadowing. And just behind the darker zone, there will be space, which will be called an acoustic enhancement. So these are the things. Now just experience it. So just experience it. This is isoechoic zone. right? Because this area is similar to this area. This is an anechoic zone, and it will be hyperechoic zone, right? And because this is present behind an anechoic zone, we will call it acoustic enhancement. Okay, so this is actually a picture of a lever, so you can experience it. So just experience it. The all over the lever is actually isoequic. We usually write this structure. So if there will be an like any kind of abnormalities, it will be clear that there is no abnormalities because this is all over isoequic. Think if a tumor is present here, then the color will be changed. But whenever you are going to write the liver is isoequic, at that moment the doctor will understand that the liver, it will not have any local disorder or any other things. So liver is clear. This is isoequic, right? These are the blood vessels of the liver, which is looking here like anechoic. This is the diaphragm. So we have already experienced that diaphragm is hyperechoic, then liver, and liver is hypoechoic, then this diaphragm. Another thing you can experience that why this liver is just think it's look like abnormal, right? The diaphragm is look downwards and the liver look upwards. Usually it doesn't happen. So how we did ultrasonography of that person? Did we just cap the legs upwards and make the head downwards? Actually no. Whenever we are going to ultrasound, at that moment we usually pass the ultrasound from the rib cage, so from the downward side. So the sound passes at first the skin, muscles, and the downward part of the liver, and then it reaches towards the diaphragm. That's why it looks like that. Okay. So whenever we are going to do ultrasound, the passing area, the passing zone will be shown above the monitor, and the distal part will be shown the below side of the down side of the monitor. Okay. Now the type of the transducer. There are many types of transducer. We can have a look. This is called like linear transducer. This is curvilinear transducer. This is called sector transducer. This is TVS, and I have already mentioned the other transducers. These are the advanced transducer. These are the 3D transducer. Now the difference of this kind of transducer. If the fixed type of transducer will be there, then it will be very easier. But remember, whenever we are going to examine the deeper structure, at that moment we need to use the low frequency transducer, because whenever you are going to increase the frequency, it will be so high, it will lost all of your powers, it can penetrate the body. So whenever you are going to watch the low frequency structure, you can easily see all the detail of the deeper structure. Like if anyone asks you to examine the liver, kidney, gallbladder, pregnancy profile, if you use the high frequency transducer, you can't see all this structure. So you need to decrease your frequency. So during examining this abdominal structure or deeper structures of the body, you need to use low frequency transducer. On the other hand, whenever you are going to examine the superficial structure, at that moment you need to use high frequency transducer, like breast, thyroid, testes, or any superficial blood vessels. We need to use high frequency transducer. Okay, so now you can fix it. The linear transducer usually is a high frequency transducer. So if anyone asks you to examine the liver, you will not choose this transducer because this is a high frequency transducer. Whenever anyone going to tell you to examine the thyroid gland, at that moment you will pick this transducer. Same for here, the convex or curvilinear transducer. So this is the most usable transducer in the ultrasonographic sectors. So convex or curvilinear transducer, the frequency of convex or curvilinear transducer is very low. It's 2.5 to 3.5 megahertz, and you can use all the, you can examine all the abdominal organs, pregnancy profile by this transducer. So now there are other transducer which is not very important right now. These are not the basic transducers, so I have completed this portion of transducers here. Now the mode. A mode is not available right now. A mode means amplitude mode. Usually whenever we're going to do a scanning which reflects with your pulse waves, this will be A mode. But in ultrasonography, this is very hard. So if you are going to ask someone to have an A mode ultrasonography of liver, you will find there are a number of waves. right? It will be very difficult to understand this wave and diagnose any kind of pathology, whether present in the liver or not. So basically, A mode is very difficult. Okay, it's just like an ECG, right? So if we were going to examine the heart, you can at first we will ask the patient to do an ECG. But in case of ultrasonography, for ECG, heart is only one organ. But for ultrasonography, only liver, like gallbladder. Just there are so many organs, you know. So if you are going to memorize about all the structures of A mode, it will be very difficult. So this is not that much like familiar nowadays. So these are the nowadays we actually use B mode or brightness mode. So B mode or brightness mode is the fixed pictures of negative light pictures, which you people all are familiar. So B mode is very important, and we also use the real-time imaging. So whenever we fix a transducer in the body of a patient and move it, this moving thing is known as real time, and whenever we're going to freeze it, it will be B mode. So whenever anyone going to ask you that what kind of mode we people are used at that moment, the answer will be B mode with real-time imaging. So when real-time imaging, when it is unfreeze, we move the transducer and examine the structure. This is real time, and whenever we freeze it, this is B mode or brightness mode. There are other modes. Before that, I'm going to show you the pictures of some mode. This is actually A mode, the pulse wave. This is very difficult, right? So whenever we're going to see, this is a head of a fetus. This is the head of a fetus. This is actually a picture of B mode. But whenever you are going to experience the A mode picture of it, it will be just like that. So it will be very difficult by understanding fetal skull by seeing only this structure. But in case of B mode, you can understand this is the skull outline, this is fox cerebri, this is the brain materials. So these are very easy by using B mode. Okay, so B mode or brightness mode I have shown. Here I can tell you one basic thing. Think, what is it? This is a black zone, right? So it means it is containing only fluid. So this is urinary bladder, and behind the urinary bladder, this is a structure which seems like uterus. So there are few layers of uterus. This is the endometrium. It means endometrium is containing more cells than the other part of the uterus, right? So we can just generalize these things from here. Well, so B mode is very important. There are two other modes, which is known as A mode or motion mode. You can experience whenever we are going to do some kind of fetal heart rate, examine the fetal heart rate or something like that, or flow of aorta or other things. At that moment, we use this M mode or motion mode. And the last thing is Doppler mode, the color Doppler, which is usually used during vascular study. So I'm going to show you, this is a fetal heart. Whenever we are going to experience this fetal heart, at that moment, we can use this M mode. This is just reflecting the fetus is alive and the pulse, the heart wave of the fetus. It looks very good. And this is very precious as well, because this is very important. Fetus is very important for his or her parents. Well, this is the flow of the aorta. We also measure the flow of aorta by using the same mode or motion mode. So this is also a picture of a mode. And the vascular mode, only the picture which contains color, which is vascular study, which is Doppler mode. So there are the 5 type of mode we usually use during ultrasonography. So I'm going to show you some kind of 3D structures as well. Nowadays we are getting advanced, and we use 3D-dimension pictures. The 3D pictures are like that. They will be 3 different axes by which you can understand the fetus. But if you add these 3 axes, it will create like that, a fetus face. So this is very interesting. This is a 3D structure. Okay, so this is a real picture of a baby, and the 3D picture of the baby is here. Okay, I'm repeating. Whenever the frequency will increase, the penetration will decrease, and whenever the frequency will decrease, the penetration will increase. For this reason, whenever we're going to examine the superficial structure, we will use the high frequency transducer. On the other hand, whenever we're going to examine the deep structure, we will use the low frequency structure. So this is a common rule, but one thing you have to know, that If we increase the frequency, at that moment the picture will be clear, and whenever we will decrease the frequency, the picture will be not that clear. So there is an importance of resolution as well. So in summary, we can say frequency is inversely proportional to penetration, beam penetration, and directly proportional to resolution. And that's why we needed to introduce transvaginal transducer, by which we can make a high frequency transducer, so we can clearly see the internal genital organs of men. So here is the procedure by which we can usually ultrasonogram do. So I have some pictures for you all. Here we can see the kidney, liver, and diaphragm. So at first, I'm going to explaining this by this way. This is the part where we started ultrasonography. It means transducer is here, and it is just creating some sounds. It is penetrating here and goes here, right? So this is the lower part of the liver, and this is the upper part of the liver. And the upper part of the liver, there is a hyperechogenic structure, which is diaphragm. And in between three structures, we can see the least echogenic is kidney. Then the cellular consistency is more in liver, and the high cellular consistency is present in the diaphragm. Okay. Some another picture, this is the gallbladder. So gallbladder is an anechoic structure because it contains just bile or gall. This is the liver, this is a blood vessel of a liver, and this is diaphragm. Again, this is a diaphragm, the liver, the blood vessel of liver. And the lower part is here. This is the skin, muscles on the lower part of the liver, and diaphragm is here. It means this is the upper part of the liver. So again, liver, kidney, diaphragm, liver, kidney, diaphragm. Here is a spleen. We can see here is the spleen. This is a picture of the left side of the body. So end of the liver and spleen. This is the anterior abdominal wall. Here the posterior abdominal wall. You can see. That's why in the posterior abdominal wall we can experience aorta, inferior vena cava. Just think, transducer is placed the anterior part of the abdomen. It is creating some sounds, and it's just crossing the scanning part of the body. So just anterior part towards the posterior part. So in the posterior part, there will be the spine. So the vertebral shadow is here. This is an urinary bladder. You can experience the bladder contains urine. This is fluid. That's why it just anechoic. Okay. This is the fetus. This is very cute picture. This is the like upper portions, like head of the fetus, the body of the fetus, the leg of the fetus, and the fetus lies on the amniotic fluid, and that's why the fluid is anechoic. This is the gender of the fetus. We can understand, like there are many people who like to know about the gender, but this is not that much good thing. Though we can understand, if medically we needed to know that moment, we can experience. This is like male lies the outside of the body. On the other hand, in the female fetus, we can see 3 lines instead of having any structures outside of the body. This is anechoic, like hypoechoic, hyperechoic, and like hypoechoic. This is also known as sandwich sign, which can be seen in the female fetus. Now, a pathology. Think, I have already told you the liver will be isoechoic and homogeneous, but see, this is not homogeneous. The condition is not that much isoechoic because there is a hyperechoic structure which is not similar to the liver surrounding cells. So this is the pathology. So thus we actually diagnose the pathology of the liver or other structures by scanning the echogenicity. So there are multiple echogenicities, right? So this is basically the pathology. So this is a gallbladder stone picture we can experience. The gallbladder needs to be empty, but it's not empty. There are some hyperechogenic structure, and that are creating posterior acoustic shadowing. So clearly multiple stones within the gallbladder. This is the picture of kidney. There are 2 cysts. Cysts means fluid containing structures, which presents in the both pole of this kidney. So this is the right kidney, bipolar cyst in the right kidney. This is the left kidney, which is normal. This is the dilated kidney. It means there is like water containing kidney, hydronephrosis, we can see kidney usually will be just like that, but you can experience the kidney is not like that. It is very much dilated with water. So whenever kidney containing water inside of it, simply is known as hydronephrosis. The urinary bladder containing stone, because there is a hyperechogenic structure which is creating some kind of posteroacoustic shadowing. So this is simply urinary bladder calculi or stone. This is an ovary containing multiple cysts. This is actually a picture of ovarian syndrome or polycystic ovarian disease. Thus, we actually examine our physiological structures of ultrasonographic organs as well as the pathological conditions. So I thank you. People enjoy. Thank you very much. So welcome back with the machine. Now I'm going to show you about the ultrasonographic machine as well as the procedure of an ultrasonogram picture. So now there is a machine which already I have mentioned. This is the monitor of an ultrasonogram machine. Then this is the pulse control part. Here is the keyboard, the printer, and the hardware part. There are 3 transducers in this machine. The first one is the curvilinear transducer. I have already mentioned, whenever we are going to examine the deeper structure of the body, we will use this curvilinear transducer because the frequency of a curvilinear transducer is low. On the other hand, whenever we are going to examine the superficial structure, we will use this high frequency linear transducer. There is another transducer here. This is TVS. So now I'm going to show you about the pulse control keys. So here we can see the freeze button. So whenever you're going to fix any structure, we will just press this freeze, and if we want to unfreeze again, we will unfreeze it. That's it. Now about the gain. So before examination, we have to fix the gain. So look, this is getting widening and this is getting darker. So whenever we are going to fix an organ which is real color, we have to fix this gain first. So there are some another gain keys. We have to, whenever we need to change the gross gain, at that moment we will use this. There are the distance measuring and the other measuring key tools here, and there are some Doppler keys here. So we are going to start now. If you, I have already mentioned about one thing, like whenever you are going to divide the screen with the dual screen, we can use this dual screen key as well. So I'm just making the single screen now. Now I'm going to show you how actually we do ultrasonogram. Before that, I need to take proper greetings from my patients. So in that portion, I'm going to ask the patient in Bengali because he is a local patient. I'm not going to show you the face of the patient, but with all, we are going to take the greetings. Assalamu alaikum Baba, আমি আপনার পেটে একটু পরীক্ষা করতে চাই, ঠিক আছে? এখানে একজন থার্ড পারসন অ্যাটেন্ডেন্ট আছেন, আমি কি থার্ড পারসন অ্যাটেন্ডেন্টের উপস্থিতিতে আপনার পেটে একটু পরীক্ষা করতে পারি? আপনি কি আমাকে পারমিশন দিচ্ছেন? আচ্ছা, আপনার কোনো সমস্যা হলে আমাকে বলবেন. So after taking the readings, now I'm going to expose properly and gently. So now I'm going to just expose the part of the patient. Here I'm going to show you about the abdominal examination. So I have to expose the abdomen first. Now, and one thing, this is a corona phase. We need to know. That's how we have to maintain this proper mask and goggles, which already I have just used. For me and for the patient as well. You can use the mask for the patient if the patient feels comfortable, and try to make distance. But this is this is a very tough to make distance by doing ultrasonogram by making distance. Though you have to take the proper precautions. Now I am just applying the gel first over the abdomen. Now I need to check the abdomen. That's why I'm choosing this one, curvilinear curve. And this curvilinear curve will contain the low frequency. It will create the low frequency ultrasonographic waves. So now I'm going to check. First, look, it is just looking whiter, and that's why I'm just going to check the gain. So I'm using the gain button first. Now I will use the picture. So you can see the liver. I have already told you all that this is homogeneous and isoequic. This gallbladder, I can see gallbladder here. So gallbladder is anechoic. I can see the diaphragm here. The diaphragm is more echogenic than liver. You can see here as well. Like here, I can see the liver and the diaphragm. Okay. So whenever I continue, come around the right side, it will show the kidney as well. So very interesting picture. We can see three structures here: liver, kidney, and diaphragm. The highest echogenicity can be seen in the diaphragm, then the liver, and then kidney. And if I again want to examine the gallbladder, we can see here is the gallbladder, the anechoic one. So these are the things we can see. Now, if I want to examine the pancreas, in the middle part of this is the pancreas in the main abdomen, middle part of the abdomen, and so on. We can examine the other things. So whenever we know about the normal echogenicity of a structure, at that moment it will be very easy for us to understand about the pathology, because whenever the echogenicity will be altered, it will be a pathology. So thank you very much. This is the end of the session. Now we will just clean, or us to clean the patient over the all the gels over the abdomen, and we have to thank our patients. Thank you very much.